Good Sunday morning, folks, and thanks for joining us. I hope you all are having a fantastic weekend so far. Well, up first this morning, we are talking about lung cancer awareness, and we are sitting down with Dr. Frank Velez. Thank you so much for coming in this morning.
Thank you for having me.
Thank you. So before we really get into the nuts and bolts of everything, let's kind of talk a little bit about lung cancer itself. And I know it obviously affects the lungs, but let's talk a little bit about how one would kind of be diagnosed or would get lung cancer.
So this is one of the cancers that we have a unique risk factor, that is the usage of tobacco. More than 100 years ago, there was published the first study to identify that tobacco as a main cause of lung cancer. In the United States alone, 90% of the lung cancer are related to the usage of tobacco.
Mm-hmm.
The other 10% is just pollution, radon, exposure to other contaminants.
Mm-hmm.
But usually most of these patients don't have any symptoms until they really start the mass or the lesions growing in size, until it affects the main airway, and they start developing cough, infections, pneumonia, chest pain, and that's when they go and discover that they have this problem.
Definitely. And is it at a certain age that they start to kind of see all those symptoms, or does it it ranges from a wide variety of ages?
Most of these patients are diagnosed between the 60s and 70s. That's one of the reasons that when they get to that age, none of them are surgical candidates, but usually that age group. Most of the people diagnosed early is incidentally. Like, I did a lot of research during my training, and a lot of people diagnosed with lung cancer were patients that have a trauma, and they went to the ER and they did a CT scan on the chest and they found a lesion. Or there were patients doing just a general medical examination for a new job, but the majority of the patients usually are between the 60s and 70s.
Wow. And I know that it definitely can happen that folks who do not smoke their entire life can be diagnosed with lung cancer. What would you say for folks who, maybe do not smoke but want to say maybe they're predisposed? Is that a possibility for them?
There's some genetical risk factor that the patient can have, and also they've been, patients with COPD, asthma, chronic bronchitis, they'll have a higher risk of developing lung cancer, but not as patient smoker or secondhand smokers. The secondhand smokers that have like 20 to 30% higher risk compared to a patient without exposure of smoking.
And I know probably the number one advice is to obviously not smoke and to not smoke any cigarettes as well. But is there any advice or anything else for those who may have smoked a few years? Maybe they smoked at one point in their life, quit, or decided to do it again, to kind of go and see a doctor, maybe just as, you said there's not really symptoms until it's too far. Is there anything that they should be doing?
So, there's no like a screening program like you have with cervical cancer, with colon cancer, with breast cancer, doing the mammograms every year. But there have been some studies indicating that you have high-risk patients, ex-smokers, patients with chronic condition like chronic cough, to go to the primary care, to your pulmonologist, to your surgeon, and perform just a non-contrast, low radiation CT scan of the chest. That include the upper part of the liver and the adrenals as a screening method, and with good results. That's benefit for those patients who are high risk. And who are those patients? Smoker, patient between 60 and 70, patient with chronic cough, patient that were exposed to secondhand smoking, patient that work outdoors with a lot of exposed to a lot of contaminants, chemicals.
Wow. And how often or how common is it to be diagnosed with lung cancer?
So worldwide, 1.2 million people are diagnosed with lung cancer every year.
Wow.
In the United States, the American Cancer Society had published that by last year, 2018, there were 230,000 new cases. So it's the most common cancer diagnosed worldwide, and it's the second most common cancer in the United States after breast cancer.
Wow.
But there is also have the 30% of all the cancer-related mortality. So lung cancer deaths are higher than colon cancer, breast cancer, and prostate cancer combined.
And if someone were to go to the doctor and find out that they have been diagnosed with lung cancer, what is kind of the next steps that one would take?
So, you know, go to a specialist, either to your neurosurgeon, go to your oncologist or your pulmonologist, and then we start doing some workup, make sure that what is that lesion? You know, a lot of patients have lesions on the chest, and doesn't mean that you have cancer. Bad pneumonias, recurrent pneumonia, that can leave scars on your lung, similar to what a lung mass will look like. So we have to figure out what's that. We have some guidelines with the Society of Thoracic Surgeons that in the website that depend on the characteristic. You have a patient with this age, exposure or not, high-risk patient, you have a mass, the characteristic of the mass, and they will give you a percentage of if that thing is cancer or not. But the first thing is look for help. After looking for help, see where you're standing, what your stage, because early stage of this lung cancer are treated with surgery. We resect the lung cancer and the lymph nodes, we complete the staging, and then the oncology will continue with if they need some adjuvant therapy like chemoradiation, and then follow up for 5 years to make sure that it doesn't come back. Because usually the majority of these patients, of this cancer, can come back in the first 2 years, but we follow them for 5 years.
Wow. And quickly before we go, if you can just give any kind of advice or last-minute tips that people should really think of when thinking about lung cancer, maybe ways to stay healthy or to kind of avoid that, if anything you could give them to remember.
You know, look for help for patients who are smoking. There are numerous programs for smoking cessation. Patients that are secondary hand smoker, help the other person to quit, and also don't be close to in a closed space with somebody smoking. You have a cough and you are blaming to the flu and doesn't go away in 2 months, and you smoke in the past. It can take 20 years for you to develop that from your smoking, and don't keep blaming to the cough. Just look for help. Go to your primary and make sure that they do at least an X-ray at the beginning. And after that, the primary should be the one helping you, guiding you to what the next step. Either we see a lot of these patients and help them. Hopefully, we can help them more if we reach to the community and try to do some awareness that about the symptoms and the risk, and try to find those patients with early stage so we can provide them a cure.
Most definitely. Well, doctor, I want to thank you so much for coming in and talking with us this morning, and we appreciate it.
Thank you.
Thank you so much. All right, folks, well, when we come back, November is Diabetes Awareness Month, and we're going to talk a little bit more about it when we return.